We've established what I believe are 4 pillars that are going to set the stage for the growth of CVS Health. The first is being best in class in each one of the businesses that we operate. Transforming consumer experiences. When I talk about simplification of healthcare, this is one of the most important pillars that we have, because if we can reorient and actually begin to work differently with the consumers, taking the friction out of the process, ultimately trying to figure out who is their advocate, how do we create opportunities for them to make better and more informed decisions. The consumer engagement and reimagining and transforming that is a big part of the pillar in which we're building. But you can't do that without addressing the other parts of the equation. So the providers will play a really important role. So when we say being the partner of choice, I think what we've all recognized is the challenges, the negotiating, and all of the contention that exists between the providers and the payers. We've got to be part of that solution. So it's why we've been so focused on addressing the prior authorization and the administration complexity and the technology and interoperability issues that are challenged. We believe it's our responsibility to be a part of that solution and to reimagine and to rethink how we're going to contract and ultimately how we're going to partner with the providers that ultimately makes it a better experience for the consumer and ultimately takes cost out of the system and improves the overall health and outcomes. And then lastly is this enterprise capability. So the question a year ago, some of the parts, the businesses fit together. So there were some pretty easy answers. Yes, when you integrate medical and pharmacy together, it creates lower cost, a much better experience for the consumer, but that's really not enough. So then the question is, if somebody's going into CVS and is also an Aetna member and also a Caremark member, do you actually improve the health and the cost? Yes. So those become what I would call the table stakes for how we're thinking about these businesses fitting together. But the next chapter in this is how technology will finally actually have the breakthrough so that you have an ecosystem and or you have an opportunity to serve that consumer so differently when they're inside of the businesses in which we're operating. We have a really unique opportunity to capture the advances in technology to make the experience better and actually to work more effectively in terms of how these businesses come together. And the reality is, we can't be a technology solution just in the PBM or just at Aetna or just in CVS retail or in our clinics. You have to do this in totality. So the fact that we're building and connecting technology across these businesses, and you're going to have a common experience inside the way in which we're building this, is what I'd say is the distinctive and differentiating factor in the organization. So it'll be a big part of where I say this all kind of ties everything together.